From the station that's on your side, this is Channel 7 News Good Morning Arkansas.
We are back with our sponsor, Baptist Health, today in this month's Keep On Amazing. I think this is pretty amazing. Dr. Brent Staggs is with us, pathologist and director of Baptist Health Laboratory. And we're going to talk about the Thank You Donor program, which is something kind of new.
That's right.
But it sounds great in a way to maybe appreciate those who donate blood, right?
Yeah, it's a lot of fun. So we've started this at Baptist Health Little Rock, and we're going to stretch it out to the rest of our hospitals pretty soon.
I love that. So sort of tell us how it works. If you go donate blood, you might get asked if you want to participate.
That's right. So there'll be, normally when you go in and donate blood, at the Arkansas Blood Institute, you'd give your information all just to donate blood, but they'll take your barcode and assign it to a blood bag, and they can take that barcode off, so it's all anonymous,
right?
And they can put that on a card to give to the patient. The patient can then go to the website, and they can go on there and enter that number from the barcode and give a little message to whoever gave the blood. Say, I got the blood today, or this helped me, or this was my situation.
Yeah.
And then an email will show up for the donor and say, here's what happened with your blood.
And if there's a message back to them, thank you, they can see that. And,
that's right, yeah. And so it's an anonymous communication that goes back and forth. I suppose the patient could put their name if they wanted to, but they never know who the donor is.
That is awesome. And I think, why did you guys think this was a program you wanted to do?
Well, of course, it's, anything to encourage blood donation, is always good, because we need lots of people to donate blood. As the card says, we can't make blood in the lab. Right. We can only get blood, platelets, plasma. All those things that we use lots of every day are only created by getting them from donors who voluntarily come in and donate. They're not paid to do that. They just do it.
Right, yeah. That's awesome. And have you had a good reception to it already? It's been going on a short time?
It has, just the last few weeks at Baptist Little Rock, like I said. And so, but yes, we've had lots of, we've had some of the donors turn back in the comments. And of course, the Blood Institute can see the comments as well when they come through. But so, yeah, and we've seen lots of great comments come through from, moms who had given birth who had to have blood, or somebody with a heart transplant who had to have a lot of blood from multiple different donors, and they send lots of messages. So it's been real good so far.
I was going to ask, what are some of the conditions that require a lot of blood usually?
Well, certainly at Baptist Health, we're the only place in Arkansas that does heart transplants.
Sure.
So those people often require quite a bit of blood during that process, taking the heart out back in. But yeah, some moms bleed during pregnancy or during giving birth, things like that. People with chemotherapy that have low blood counts from chemotherapy get blood, and so they often get 1 or 2 units, and they come in and get that. So it's worked real well for all of them.
So for a lot of them, it may be several donors, like you said, that they're thanking because they had several donors' blood, perhaps.
Yeah, they could have, and they certainly don't have to, comment on every single one of them, but some of them have created some real great, lengthy comments.
Yeah, I bet. Just kind of a personal touch, I guess. And usually people who donate blood, they're not doing it for a thank you, but they may get one through this system.
Yeah, it's very cool. I had not really thought of it before, but yeah, it's turned out to be a really neat thing.
That is wonderful. So when we go donate blood at Baptist, will we be asked then if we want to participate?
You can. So you donate blood at the Arkansas Blood Institute is the blood donation place. It's out in West Little Rock. You don't come physically to Baptist to do that, but we cooperate with them in order to create this program. So you donate there, and they'll ask you there if you want to be part of that. And if you do, then again, it's anonymous. They just they'll just assign your barcode to the blood bag, and then the nurse at Baptist Health can put that barcode on a card to give to the patient. Right,
so confidentiality is totally protected with this.
That's right. Nobody knows, back and forth. Certainly nobody will ever know who the donor was. The patient, like I said, if they chose to put their name on the message for some reason, they could. I've not seen anybody do that, but they could.
But they could say, hey, I'm so-and-so.
Yeah.
I had a heart transplant, and your blood was one of the things I needed, and thank you.
That's right. It made me feel a lot better, all those things.
That's wonderful. Well, thank you for telling us about this, and maybe this is something that you'll be a part of in the future. We'll all probably need blood at some point, right?
You never know. That's right.
You never know. All right. Well, let's remind everybody, of course, about Baptist Health. You guys have the health line 1-888 Baptist that is always open if you have any questions. And just be sure and check this out if you're a regular blood donor, and if you're not, maybe we all should be, right?
That's right. The main thing is to encourage blood donation. We need everybody to come out.
Thank you, doctor. We appreciate it.